The main strength of the Adult Reconstruction Fellowship program is the faculty that you get to work with.
The primary reason I chose UAMS for my fellowship was mainly due to the 4 staff here, all of which are very well renowned, many of which are society members. I felt that UAMS, being the flagship institution for revision arthroplasty in the state and for the border states, would provide an unparalleled operative experience.
We have developed a robust curriculum for the fellow that currently involves rotations with 4 fellowship-trained arthroplasty surgeons.
Not only are they all incredibly gifted surgeons, but they are savvy clinicians, and most importantly, they are wholeheartedly committed to the fellowship and fellowship education.
The environment here at UAMS, working with the joint replacement faculty, is second to none. They provide a level of coaching that I think cannot be obtained elsewhere. They also foster an environment that allows for an open exchange of ideas. There is a high volume of cases, along with a high volume of complex primary and revision arthroplasty, both the hip and knee, that I feel cannot be simulated elsewhere.
I've been able to develop very close relationships with each of my faculty mentors here in the Adult Reconstruction Fellowship program. They are committed to my education. They want to know about me as a person. They want to know about my family. They want to know about my career plans and career path and journey and how they can best help me. The main reason, aside from the faculty members that you get to work with here, is the breadth of cases that you will be involved in. Everything that is remotely complex from the entire state of Arkansas comes to UAMS, and you deal with every single problem related to joint replacement that you can think of.
The goal for our fellowship program is to train a well-competent surgeon who is comfortable tackling primary cases as well as complex revision cases, and either then going back to a private or academic type setting where they may encounter and teach residents and fellows themselves, or be able to run a private practice type model and be effective and efficient in that.
The educational experience for the fellowship is incredible.
I feel when I go into practice, I'm prepared to address all manner of complexity that may walk into my clinic.
Our fellowship program structure is unique in that we work individually with the fellow to mold his or her expectations and goals and expose them to enough complex revisions or primaries or anything in between that they need through the 12 months.
Not only are you doing a huge number of cases in the operating room, you have enough clinic time to really hone in on each clinician's abilities and way of thinking, which is incredibly important. One of the attendings during the year told me that his fellowship year was his biggest year of personal and professional growth. Looking back on this year for me, I definitely agree with that for myself. This was a huge year for personal and professional growth for me, and I'm sure that will only become more evident as I begin practice and look back on the year.